Jenny is 15 months old. Her weight is 6 kilograms and her temperature is 37 degrees. Her mother has brought her to the clinic because she has diarrhea. Check for general danger signs. The mother says that Jenny is able to drink, is not vomiting, and has not had convulsions. Now look at the child to see if she is lethargic or unconscious. Write down your assessment. Does Jenny have any of the general danger signs? Now, assess Jenny for the first main symptom of cough or difficult breathing.
Does the child have cough or difficult breathing?
Jenny has had a cough for 5 days. Count the breaths Jenny takes in 1 minute. Prepare to start counting. Start counting now. Stop counting. Write down the number of breaths you counted and decide whether Jenny has fast breathing. Now look for chest-in drawing. Write down whether chest-in drawing is present. Assess Jenny for stridor. Look and listen now. Write down your assessment. That completes the assessment process for a child with cough or difficult breathing. You should now use the findings to classify the illness. Look at the classification table for cough or difficult breathing. Choose the appropriate classification for Jenny and write it down. Next, we ask about the next main symptom, diarrhea. Jenny's mother has already told us Jenny has had diarrhea. We ask,
For how long?
The mother replies, 2 days.
Is there blood in the stool?
There is no blood in the stool. Now write down your assessment of the signs of dehydration. at the general condition of the child. You have already assessed Jenny for the general danger sign lethargic or unconscious. Now assess whether the child is restless and irritable. What have you decided? Look for sunken eyes. Write down what you decide. Would you say that Jenny is not able to drink or drinking poorly? Would you say she was drinking eagerly and thirsty? Or does she drink normally? Write down what you decide. Pinch the skin of the abdomen. Does it go back very slowly, taking longer than 2 seconds? Or slowly? Or immediately? Write down your decision. You should now use the information to classify Jenny's diarrhea. Ask about the next main symptom.
Does the child have fever?
Jenny does not have fever. Next ask,
Does the child have an ear problem?
the mother says, Jenny does not have an ear problem. Next, check Jenny for malnutrition and anemia. Look for visible severe wasting. Can you see signs of visible severe wasting? Write down what you decide. Next, look for palmar pallor. Does Jenny have severe palmar pallor? Or some palmar pallor? Look for edema of both feet. What is your assessment? Is there edema? The health worker checks Jenny's weight for age and decides that it is very low weight for age. That completes Jenny's assessment. Choose the appropriate classification for Jenny and write it down. We will now tell you our assessment and how we classified Jenny's illness. Jenny is aged 15 months. Her mother told us that she has brought Jenny to the clinic because she has diarrhea. First, we assessed Jenny for general danger signs. Jenny was able to drink, she was not vomiting, and did not have convulsions. Jenny was not lethargic or unconscious. Jenny does not have any general danger sign. What did you decide? Next, Jenny was assessed for the main symptom, cough or difficult breathing. Jenny has been coughing for 5 days. We counted 42 breaths in 1 minute. As Jenny is aged 15 months, she has fast breathing. Jenny does not have chest indrawing. We could hear no harsh sound as Jenny breathed in. Therefore, we decided Jenny does not have stridor. Jenny has a cough, fast breathing, no chest indrawing, no stridor, and no general danger signs. First, look at the signs listed in the pink row. Jenny does not have signs of severe pneumonia or very severe disease. So we look at the next row down. Her sign of fast breathing puts her in the yellow row. Therefore, we classified Jenny as having pneumonia. We moved on to assess her diarrhea. Jenny has had diarrhea for 2 days and has no blood in the stool. We looked at the child's general condition and decided that Jenny was not lethargic and was not restless and irritable. We looked at Jenny's eyes and decided that the eyes were not sunken. When offered a drink, Jenny drank eagerly and seemed very thirsty. When Jenny's skin was pinched, the skin went back immediately. Jenny has none of the signs of severe dehydration. Drinks eagerly is a sign of some dehydration, but Jenny has no other signs of some dehydration. Therefore, we classified Jenny as diarrhea with no dehydration, as she does not have enough signs to classify her as having some or severe dehydration. As Jenny has had diarrhea for less than 14 days, she is not classified for persistent diarrhea. As there was no blood in Jenny's stools, we decided that she does not have dysentery. We would therefore classify Jenny as diarrhea with no dehydration. Jenny did not have fever nor an ear problem. Next, we checked for malnutrition and anemia. We decided that Jenny does have visible severe wasting. Jenny also has some palmar pallor. Jenny does not have edema of both feet. The health worker determined that Jenny was very low weight for age. Jenny's sign of visible severe wasting places her in the pink row, severe malnutrition or severe anemia. Jenny is therefore classified as having pneumonia, diarrhea with no dehydration, and severe malnutrition.